Good afternoon. My name is Dr. Tim Driscoll. I'm a general dentist. I was a general dentist for 22 years in the western suburbs of Chicago. I was focusing on cosmetic implant and advanced reconstruction. Today, I live full-time in Collier County. Not only did I commit when I was practicing to over 200 hours of continuing education annually, I lectured and performed over-the-shoulder training for licensed dentists. I began practicing in 1986, and by 1988, we were no longer recommending fluoride toothpaste, rinses, or in-office treatments to our patients. It was a known neurotoxin even back then, and we believed in informed consent for all of our patients. Patients could still request fluoride treatment or buy it over the counter by their own discretion. I was a founding member of the World Congress of Minimally Invasive Dentistry. This dental group met multiple times a year to discuss procedures and techniques we could use to prevent tooth loss. We found no change to the rate of carious lesions for our patients not using fluoride. In fact, with the advent of the Cavo laser caries detector in the year 2000, we found many hidden carious lesions in the deep fissures on the occlusal or biting surfaces of the teeth. Using water lasers or microinstruments to assess this decay, our practicing dental members found that fluoride, although it may have hardened the outer covering of the enamel or tooth, carious lesions were found tunneling deep and narrow under the outer covering, causing more extensive and expensive restorative care for the patient. Thus, the fluoride was masking early signs of decay, and only with lasers could we detect the deeper, more advanced decay. Furthermore, fluoride does not address the root cause of decay, which is bacterial infection. Secondarily, decay increases with poor home care, poor eating habits, and medications or trauma that decrease saliva. Saliva is the body's #1 defense to decay. Thus, we chose to identify the cause of decay for each individual and resolve that issue, making fluoride irrelevant. Although it's been stated that fluoride prevents decay, it does not. It can only recalcify decalcified tooth enamel. Decalcification of tooth structure is caused by a bacterial infection. Fluoride does not eliminate decay-causing bacteria, thus only addresses the symptom and not the cause. Ironically, in-office concentrated fluoride treatments require no food or drink for 30 minutes after treatment because direct contact with the tooth structure is required for the stated effectiveness, and drinking would dilute the effects intended for that treatment. So fluoride in water supply does not ensure continuous contact. Actually, fluoridated community water makes no sense with the availability of over-the-counter or even prescribed fluoride products. Since fluoride does not eliminate decay and is a known neurotoxin, it is my recommendation to remove fluoride from our community water and your community water, and let citizens make informed decisions for themselves and their families on the use or elimination of fluoride in their daily lives. Thank you for your time. Let's protect our brothers and sisters, especially pregnant women and young children.